welcome back to The Real in Healthcare, where we keep it real in the health field. I'm Crystal Robinson.
I'm Ariel Shirley.
And I'm Chelsea Gibson.
And for today's topic, we're going to go ahead and talk about racial and ethnic disparities. Are you ladies ready?
Yes.
Audience, are you ready? As we know, healthcare ethics is a set of moral principles, beliefs, and values that guide us in making choices about medical care, sense of right and wrong, and rights we possess and duties we owe others, which I believe, of course, is an essential part of working in the health field.
Yeah, it's very needed.
Of course, of course. And so when we talk about racial and ethnic disparities in healthcare, it's obviously an issue, and the issue has started to be addressed, and some solutions are to raise public and provider awareness of racial ethnic disparities in care, improving the capacity and number of providers in the communities that are underserved, which I also believe is a wonderful, wonderful thing, because if you're providing more resources for communities that are underserved, of course it's going to open doorways for African Americans and whites as well to receive health care. Also, patients belonging to minority populations receive lesser quality of health care. And of course, this presents a challenge for physicians who are committed to serving their patients equally. You know, I'd hate to be a physician and run into a problem like that. That's
So I have to sit there and think about, should I treat this patient differently?
Right, exactly. Just because of healthcare. I mean, that's crazy. Everyone wants to be healthy.
And you know, people actually still go through that till today, you know, where they deal with people who aren't treated, you know, right just because of the type of health care that they have, which is, you know, never the right thing.
Right. Who are you to take the right of someone's health away because of healthcare? You know
Exactly.
And so some stats that I was reading the other day that really awed me is there was a survey taken, and the question was, when going to the doctor or health clinic for a healthcare service, do you think most African Americans receive the same quality of healthcare as whites? Higher quality of care or lower quality of health care? And can you believe that 57% felt that it was higher? How crazy on a fair is that?
Higher?
Higher.
How?
57%.
More than half.
That's ridiculous.
Wow.
But I do feel as though healthcare ethics definitely ties into the racial and ethnic disparities. It makes it harder for healthcare professions.
Exactly. And you know, that brings into another topic, you know, like the disparities in the healthcare in the United States still remain as a big challenge in today's world. But, you know, with the Affordable Care Act, we have the coverage expansion, which offers an opportunity to increase coverage among people of color. And, you know, this could help reduce long-standing racial and ethnic disparities in the healthcare, you know, field. And, you know, the really main goal of the ACA was ways to increase health coverage by establishing a new coverage opportunities, you know, for lower and people who are our moderate income individuals, which is, you know, that's like a great way to make it so everybody could afford health care.
That coverage would help with the communities of color.
Exactly.
Help the communities as well. And, you know, can y'all believe that back in 2013, there was 41.3 million people who were not covered by insurance.
That is a lot of people walking around without health care insurance.
41.1 million people.
That's unacceptable.
That is just ridiculous.
That brings me into access and quality of care, dealing with the racial and ethnic disparities. Black and Hispanics are more likely than whites to have a normal doctor, a regular doctor to go to.
Oh wow.
And that sounds crazy.
It's ridiculous. Everybody should be able to provided the access of care to be able to get a checkup, just a regular checkup. And then the quality of care with health care. The screening tests, the medications, the lab tests, those are all done on a different spectrum when it comes to the minority population. Black Medicare beneficiaries with cancer, they're deprived of the invasive surgeries, the procedures, and the therapy and the treatment.
Oh wow.
That's crazy.
Due to in comparison to whites, which is ridiculous. Just because I'm a black and I have Medicare, I feel like I should be able to have the same rights and treatment, especially when you're dealing with surgeries and doing something as serious as cancer. Then the white people, I should have the same. We should be right here.
Exactly.
Exactly. I just think that's so crazy because Why is it? Why I don't understand. Why can't just African Americans and whites have the same
benefits,
treatment when it comes to healthcare?
Right, exactly. Everyone get the same type of benefits in the healthcare field. She may get this, she may get that. It should all be the same,
regardless whether I have Medicare,
exactly,
whether I have the top insurance company. Everyone deserves to live.
And we also came and thought we would have a special guest to come and just give you guys more information about what our topic is for today, which we have a special guest, Larissa Jones, and she's going to elaborate more on the topic of the cost dealing with the racial and ethnics and the health disparities. So we're going to take it away.
Thanks, Chelsea. Racial disparities in life expectancy are a key indicator in health outcomes. Although the United States has made progress to narrow the gap in life expectancy between blacks and whites, their disparity still remains the same. Largely in blacks are higher death rates at a younger age due to cancer, heart disease, and diabetes, and etc. Eliminating the racial disparities can improve the equality in health and healthcare field all around, as well as the cost. Racial health disparities are associated with the annual economic loss nationally across the board, with spending an estimated $35 billion in excess health care expenditures, $10 billion in illness related to lost productivity, not being able to go to work, having to take leave, not being able to complete a job or task at one time, and over $200 billion in premature deaths. For example, reducing disparities in effective asthma treatment by just only 10% for African Americans, workers could and would save more than $1,600 annually alone in just medical expenses. That is not including any treatment or any medicines they have to buy. Eliminating racial and ethnic disparities in access to outpatient mental health treatment could reduce costs as well. It's really the little things that count in trying to find the lowest cost in these health disparities. Primarily for Americans who have Medicare and also Medicaid. You would do this by limiting the emergency room visits and how many hospitalizations they have per year. That is why the health cost is rising and will never reduce to where we want it to be. Unfortunately, many with low incomes live in the South, and in most states in the South, they have opted out not to expand the Medicaid Act. Hence, the lowest incomes will continue to experience disparities that could prevent better access to care, better access to treatment, doctors, and even medicine.
Larissa, thank you. Wow, that was good. It brings me back to our last topic of the day, which is cultural competence and the potential to reduce the racial and ethnic health disparities by having interpreter services, by having coordinating and traditional healers, recruitment and retention policies, training, and last but not least, one of them is the use of community health care workers.
Let's talk about that community. That's excellent. That's an easy way right
there. Getting the community involved. They're going to want to elaborate more, have more people to come out once they see this community is getting involved, and it's going to help spread all over the world,
I agree.
Wonderful way.
This has been a good talk.
So that was for today's topic in the healthcare field.
Where we keep it real.
Keep it real
in the healthcare field.
So join us in next week where we're going to have a new topic to discuss in the healthcare, maybe an issue or a current event. And we just want you guys all to join in and, get information on it.
All right. Thank you so much for joining us.